Namaskar and a very warm welcome to this phone-in program. I'm Nidhi Kumar and you're watching India Science. India has reported 35,499 new COVID-19 cases in the last 24 hours. The current recovery rate stands at 97.40%. The country has seen a total of 40,2188 active cases at present, but the plus thing is that there are 50 crore plus vaccinations so far across the country. And in this phone-in live, we take your queries live and answer your questions. We are joined today by the very eminent Dr. Anup Kumar, HOD Urology, Robotics and Renal Transplant at the SJH and VMMC Hospital. Many thanks for joining us today, sir. Thank you so much for sharing your views today on this very, very important program. So, my first question to you would be that as we cut across and see that many world countries are facing a spike in COVID-19 cases, what do you have to say to all our viewers about the Delta variant and its transmissibility, sir?
Nidhi, good evening. As we know, many countries are facing re-emergence of cases of COVID-19 because of various Delta variants, and India is also having Delta and Delta Plus, and which is found in many states now. And as we know, the second wave, we had a lot of cases because of variant. Plus is again has been considered as a variant of interest and variant of concern by the WHO, and therefore that we have to follow even when our second wave is going down, and of course we have to it up because Delta Plus and other variants which are now in other countries can rise to the third wave, and which can be as fatal as the second wave.
Yes, sir. It can trigger a third wave also. Meanwhile, joining us is our first caller, Rekha from Surat. Namaste, Rekha. Please ask your question.
Hello, ma'am. Hello, sir. Sir, my question is, what precautions can be taken, by kidney failure patients before taking COVID vaccine?
So, the kidney failure patients, if they are undergoing dialysis, then they should show that before going for vaccination, they don't have any fever, any bleeding diathesis, because sometimes these patients have bleeding coming from either the puncture site or from the urine. And CKD patients, they have this they are more prone towards the bleeding disorder. So they should not have the fever, they should not have any bleeding diathesis, vaccination, and they should be having stable disease. So any chronic kidney disease patient who is having acute kidney failure, that patient should not receive vaccination on that particular moment. Once he recovers from that particular disease, then only he can take COVID vaccine.
Joining us is our second caller, Ms. Chaudhary from Mumbai. Yes, please tell us your question, Ms. Chaudhary. Namaste.
Namaste, ma'am. Hello, sir. This is Suvreen Chaudhary from Mumbai. So my question is that what are the precautions to be taken by urology cancer patients before taking COVID vaccine?
So all the patients who are having urologic cancers like prostate cancer, bladder cancer or kidney cancer, these patients must make sure that their disease have been treated, like undergone surgery recently, the vaccination also after surgery, for receiving chemotherapy, just to make sure that their blood count are okay. Because some of these patients who have cancers, they receive chemotherapy and they have neutropenia. That means their neutrophil count goes below cutoff value, and which predispose them to having a lot of infections. So if they have neutropenia, they have fever, they should not go for vaccination on that particular day. They recover from that particular disease, and then they should go.
Absolutely. So, all that is answered for you, Suvreen. We now have our next caller, Suraj from Nagpur. Namaste, Surajji. Please ask your question.
Hello, ma'am. Hello, sir. Sir, my question is there are any contraindication for taking COVID vaccine in patient of urologic disease?
patients who have chronic disease and they have undergone kidney transplant, ideally they should receive vaccination once they have stabilized kidney transplant, because in the initial phase we give high dose of steroids and immunosuppressant drugs to these patients to avoid rejection of the graft. So the recommendation is that within next 3 or 4 months after renal transplant, once the patient stabilizes, the steroid doses is decreased to a minimum level, and they are recommended to go for COVID vaccination, not before that. Similarly, those patients who have cancers and they are getting chemotherapy drugs, if they have, as I said, severe neutropenia and decreased blood counts, that particular moment they cannot take vaccine. Once they recover from that particular insult of chemotherapy, then they can go for vaccination. And then those patients who have kidney stones and have urosepsis, have fever, infection, they're positive, these diseases.
We have another caller joining us, sir, Amita from Noida. Yes, Amita, please ask your question.
Hello, ma'am. This is Amita. Sir, my question is that my sister is facing urinary frequency, and is this a COVID symptom? And what can be the precautions that she should take?
Urinary frequency per se is not a COVID symptom, and females as such, they have a very common incidence of frequency and even urgency and recurrent UTI. So, common in females. We call them as overactive bladders, or recurrent UTI is also very common. COVID per se does not predispose to having a urinary frequency or any other specific urological problem. But yes, when you get COVID, your immunity goes down, and if you have diabetes, which will compound your immunity problem, then you might get UTIs because of decreased immunity, not because of COVID per se. So this is indirect, you can say, side effect of COVID, because the immunity can go down, and then you can catch urinary infection.
Absolutely, sir. Another very important question on our YouTube, and I'll just read it out for you. COVID-19 causes severe blood clots, lung thrombosis, and might clog the kidneys too. So what precautions can we take to avoid that? Especially the caller, it is assumed is having a lot of kidney stones. So they're wanting to you to clarify on that, please.
So definitely COVID predisposed to thrombosis as well as thromboembolism, and they have vein clot, they have clot in their limbs, and also the major vessels they have happened. So they have kidney stones and they get COVID-19 disease, they should monitor their parameters, which will be under supervision of a physician, and they will also check the coagulation profile of the patient. And if they feel that your coagulation profile is getting deranged, then they start you on anticoagulants so that you don't get those problems. It is very that if you have an infection and you have urological diseases like stone, which is causing sepsis, or you have chronic kidney disease, then you should so that you don't get these thrombosis complications.
Absolutely. I request you, sir, to check the audio at your end because the voice is fading away at times for it to be more clearer. Right, sir. We're joined by yet another caller, Akansha from Noida. Please ask your question, Akansha.
Sir, my question is, for patients of urology, what should be the appropriate gap between 2 doses of, Covaxin and Covishield?
Both the doses, for both the vaccines, she wishes to know both the doses.
So, if you're taking a Covaxin, to take an interval of 4 to 6 weeks for the recommendation of a government of India. If you are going for Covishield vaccine, that is 12 weeks now, and from 12 to 16 weeks you can get it the second dose. And the reason for this increased gap for Covishield, it was found that in many publications, level increases after 12 weeks, and side effects they are also same as we explained earlier. So that's why the government of India has changed the gap now to 12 to 16 weeks for Covishield.
Right. So another question on our YouTube wall is that in case the RT-PCR is not being able to detect the COVID positive strain in a patient, then what does the patient do? I mean, what other tests are being done today by the government of India to establish the fact that the patient is suffering from COVID? Because the patient is having COVID-like symptoms, but it is not traceable.
It's a very good question because we know that RT-PCR has got its mutation. The RT-PCR is close to 70 to 75%. Therefore, 20-25% patients can still have false negative test. The restrictions by Government of India are that if patients which fall in the category of COVID, even if PCR is negative, the physician will advise the patient to get isolated himself and to follow all the precautions for a COVID infection. And after 2 weeks of isolation and when the symptoms are already relieved, then patient can come outside and do his normal activities. So even if your RT-PCR is negative, but your symptoms are suggestive of COVID infection, you should consider this as COVID infection only and get self-isolated. Although there are certain other tests which can be done, which are being done in certain government labs, but still RT-PCR is a common test which is being done. In some selected patient, if you have lung disease, lung symptoms like decrease in the oxygen saturation, dyspnea, they might go for CT chest. Again, it's only very selected patients, and on CT chest, they might get some indirect evidence of COVID infection. So this is again one scenario when some other test might help you in clinching a diagnosis. For most patients, it's the symptoms and correlation with the surroundings. Like if you're living in a red zone area, then any fever with cough and cold will be considered COVID-19 infection unless proved otherwise.
Absolutely, sir. We're now joined by another caller now, Nikita from Mumbai, joining us. Namaste. Welcome to India Science. Nikita, please ask your question.
Sir, my question is, what COVID precautions can be taken by a patient who has undergone renal transplant, if you can elaborate on that?
So the patient has got a renal transplant. First 3 months are very, very critical for that patient. That patient should never go in public for 3 months after surgery. He should be inside and using the mask all the time. He should get his all medications and proper time, which are immunosuppressant drugs, because these drugs are very vital to prevent the rejection of the graft. Like it's an ongoing COVID pandemic time, then it's better that he can take a teleconsultation from a doctor, should go to the hospital for follow-up, and the doctor can change the drug doses and patient on phone only, and so that he can minimize his hospital visits for initial 3 months. 3 months have gone, if the graft function would have stabilized, then also precautions will continue, but the risk will increase after 3 months.
Absolutely, sir. Joining us is another caller. Mr. Raman from Bihar. Namaste. Welcome to India Science. Please ask your question.
Hello, ma'am. Hello, sir. Sir, my question is, what are the major urological problems faced by pregnant and lactating mothers?
So, pregnant and lactating mothers, So these group of patients, they have more predisposition to infections because after pregnancy, what happens is there is a change in the hormonal balance of the female, and they urinary infections, which can be lower tract infections like cystitis, or it can be upper tract infection like pyelonephritis, that means the infection of the kidney, which can be very severe, and patient can have a high grade fever, pain in the abdomen, nausea, vomiting, and even blood in the urine. These patients can progress to sepsis also. So this is one group of disease pregnant lactating woman can have after pregnancy is over, then they can have overactive bladder. As I was telling in the initial part, because of the hormone changes, these females they get frequency, urgency, cannot control your hold. They can and they have to go urine to pass urine immediately. These patients they require a urology consultation. Simple test to diagnose these problems and even during lactation, of course, not during the pregnancy. Have some special which are safe. See, those even similarly for the lactation period, there are selected drugs which can be given because when the female is breastfeeding the child, drugs can be secreted in the milk and can affect the child. So therefore, it's a very special group of patients. They can have infection, can have overactive bladder, and therefore they require a good urology care. They have these symptoms.
Absolutely, doctor. Another question on our YouTube, which is flashing again and again, I need to take that, is what is your take on the vaccines for children below 12? Because between 18 to 12, we hear that trials are on. What would you like to say? And what are the kind of vaccines that you see coming in for children? Please elucidate, sir.
It's a very important question which is being discussed all over the world because everybody is worried about the kids which are younger than 12-year-old.
Yes.
There are trials going on between 12 to 18-year children, and they have shown efficacy of the drugs like Pfizer and Moderna for this age group for 12 to 18, and they have been approved by many countries also for the children like Canada and US. However, for children less than 12 years, we still don't have enough data, but the trials are going on, and we are hopeful that the current vaccines we are using in more than 12-year-old children and above, they can be also used in less than 12-year-old, but we have to wait for more data to evolve because this group of patient is very sensitive group, and they cannot complain about what is happening to them after the vaccination, and it's very difficult to monitor side effects in these groups. So therefore, the government of India and other governments are very careful before they declare any vaccines safe for this particular group. But I am very hopeful in next few months we'll have the vaccine for this group also.
Absolutely, sir. And as you rightly said, that these children are not able to even convey the fact what post-vaccine reactions they would get. So the government is taking all necessary precautions. We joined by another caller, Mehika from Lucknow. Yes, Mehika, please ask your question.
Hello, ma'am. This is Meeka. Sir, my question is that there is a big debate on the regular use of ultrasound and CT scans for the testing of COVID and its safety as well. So my question to you is that how much extent is the ultrasound and CT scans harmful? And can you please tell that in the context of kids too?
To add to this by asking you, doctor, there was a report which said that one ultrasound is equivalent to 300 X-rays or something like that. I think it is in that context that our viewers are asking this question. Please tell us.
So first I want to clarify that ultrasound does not have any radiation exposure. So ultrasound is absolutely safe. That's why it can be done even in pregnant women also. Okay, so for ultrasound, there is no contraindication, no side effect. So even in COVID patient, ultrasound is not routinely. It is done only if the patient got some symptoms. Like we were discussing the kidney problem. So if he has got pain in the abdomen repeatedly and vomiting, some interrupt, only ultrasound, then we are going to get it done. Doesn't have any radiation exposure. But yes, investigation which was used right and left in the second wave throughout the country, and in many instances it was misused because it was not required. I think that's why the government of India, they have published this that it should not use only selected, should be used at the recommendation of physician. And therefore it is very important, no patient should go for CT chest on his own. If he has COVID, consult a physician, follow the advice of physician, There are certain guidelines which are published now. You can also access those guidelines on Ministry of Health Family Welfare website. It clearly says in what conditions it should be done, and those conditions are if patient is in the second week of COVID infection and he is showing decrease in the oxygen saturation and his breathlessness is increasing, or he's developing more complications. These are the patients when you want to assess whether patient is developing pneumonia-like condition, or if his fever is increasing, it's more than 100 to continuously without even with medications. These are the group of drug patients in which you might go for HRCT test, but that too with the advice of a physician. Otherwise, it should not be used as a over-the-counter investigation for all COVID.
Absolutely, sir, and a very, very valid point that you have just said, that ultrasound is safe and CT scan you must go only with your doctor's permission. We joined by yet another caller from Chandigarh. Pooja, namaste. Welcome to India Science. Please ask your question.
Namaste, ma'am. Namaste, sir. Sir, my question is, when can a person take COVID vaccine if he or she has suffered from COVID? Is it different for different vaccines? What is the usual,
It's a very, very important question, and it is often asked at various platforms. So, if somebody has suffered from infection, and once he is fully recovered means the symptoms have gone, and after that, also there is a 7 days of isolation. So that means after you are completely free from symptoms and you have been declared as COVID negative, from that time, 3 months onward, you can get the vaccine. And the reason behind that is because once you get the COVID infection, you already have got antibodies in your blood, and they are protective antibodies. They persist for a period of varying from 6 months, but after 3 months, it has been seen that their level decreases significantly. And the doctor has with this guideline that after 3 months, and this will act as a booster because it will increase your antibody levels with that jab.
Absolutely, sir. Yet another caller joining us, Abhishek from Delhi. Namaste, Abhishek. Please ask your question.
Namaste, ma'am. Namaste, sir. Sir, my question is, what COVID precaution to be taken by a patient undergoing hemodialysis?
Sir, if you could also explain what is hemodialysis, it would be very good for all our viewers, since we are making this urology special today. So, any other thing that you'd like to add about the COVID patients facing any kind of urinary tract disorders, please elucidate.
Very important question that in COVID pandemic era, the patient with diseases, they needed hemodialysis. They had a lot of complications because, as we know, COVID infection. So, they have a fistula. We call it an arteriovenous fistula through which the dialysis is done. Now, if because of this thrombosis, this fistula gets thrombosed, then you have to go for another fistula, which is very, very tedious process and takes a lot of time. So, therefore, that these patients who have chronic kidney disease, they have this procedure all the time. They should follow it closely. And hemodialysis, you are asking what is hemodialysis? In chronic kidney disease patient, if they have kidney failure, the body is unable to treat the waste product of body metabolism, like protein. These waste products only are excreted by kidney. When kidneys are not functioning, we use an artificial kidney to filter that. And that artificial filter is of different types. One is the hemodialysis, in which we put cannula in one of the major vein of the body, through which the blood will be spirited through a machine, and that will be filtered, and that will be infused back into our. So it's like an artificial filter which is doing the function of kidney, which is normally required twice in a week for these patients who become dependent on dialysis. The hemodialysis which we do for our chronic kidney disease patients, and these patients should be, because as I said, absolutely very, very vigilant about COVID-19, because if they get COVID-19, immunity is already low, COVID-19 further will depress their immunity. They are more to sepsis, generalized infection, and multi-organ system failure. And their need for ICU and oxygen and even mortality increases tremendously. So therefore, these patients should be given special treatment if they get COVID-19. And the precaution they can take is they should get themselves vaccinated as early as possible and should follow COVID appropriately.
So another question that is flashing on the YouTube is in continuation with the same question on dialysis. They're saying that does a person who's had dialysis need a longer time for rehab? That means a longer gap in the vaccines. What would you like to say to that?
So if the patient is receiving routine dialysis, they said is twice a week and is stable. Side where the cannula is placed, that side is okay, there is no infection there, and his creatinine is stabilized, and he does not having generalized body swelling or shortness of breath. These are the patients which are stable. They can go and have their COVID vaccines. But those patients who are unstable, they are having acute or chronic kidney failure. This is a term which we use when this chronic kidney patient suddenly becomes unstable and they develop suddenly shortness of breath, swelling all over the body, including the limbs, and the urine output just goes nil. So these are the patients, they should first recover from this insult and only then they should go for vaccine, because the first prerequisite for getting a vaccine is you should be totally normal during that particular day. That means your blood pressure should be okay, your sugar should be good, you're not having any fever, and you don't have any very significant allergy. This is one important thing I want to say. If you have allergy to any intravenous drug, and which is a very severe allergy. Severe allergy means you developed hypotension or shock-like condition. These are the patients, they should avoid COVID vaccine, and they should get it only at the advice of the physician.
Absolutely, sir. Very well said. Joining us now is Kartika from Ahmedabad. Namaste, Kartika. Please ask your question.
Namaste, ma'am. Hello, sir. I'm Kartika from Ahmedabad. So my question is related to cytokine storm. Can you please explain cytokine storm and how they can destroy the kidney tissues?
It's a very important question. See, we know that COVID-19 initiates a very generalized kind of inflammatory reaction throughout the body, and which we also call as a cytokine storm. Various kind of inflammatory mediators like interleukins and various other factors, they are released. These factors, they actually start damaging our various organs. And we start with the lungs. The lung is the first organ to be affected by these mediators. And that includes the brain, it includes the heart, and also includes the kidneys. So when it goes to kidney, we have an acute kind of kidney injury to the kidney, and these mediators, they cause inflammation in the kidney. Function that starts getting, and patient starts developing again problem of swelling over the face, over the body, the output, and also because of swelling in the lungs, the dyspnea also starts. So these are the patients, they should be very closely monitored. Currently they are hospitalized and they are also given temporary dialysis for a few days, because this acute kidney injury will take few days to weeks to recover. Some patients will require even IV medications control kind of inflammation. Therefore, once kidneys, that it's a very serious problem, have to be hospitalized under constant supervision of a doctor, and with various drugs and with dialysis, recover from this insult, and afterwards you have to do all COVID-19 precautions.
Absolutely, sir. And you just mentioned about cytokine storms and how they need to be handled very carefully, and the risk for COVID-19 patients. Another question on our YouTube, and probably the last one due to paucity of time, is there any relation between mucor cases and patients having renal transplant? Have you, for example, been seeing these kind of cases in Safdarjung Hospital, or what is it that you would like to tell these patients to take precautions on? What measures?
If the patient has undergone kidney transplant and then he develops COVID-19 infection, he is at a higher risk of getting mucormycosis. So what are the predisposing factors for mucormycosis? One, if you're already immunocompromised. Patients who have undergone transplant, they are receiving immunosuppressant. In fact, we give them drugs to decrease their immunocompromised. They are at higher risk of getting mucormycosis. We have seen few patients coming to our transplant OPD that they suffered from COVID and they also developed the mucormycosis. But fortunately, we could save them because they came in time and we could admit them and they got treatment at ENT and they could be salvaged. But this is a very, very high risk group, I'm trying to say, which is not only at the high risk of getting the COVID, but also at the high risk of getting the mucormycosis.
Absolutely, sir. And in the end, I'd like to thank you, Dr. Anup, for joining us today. And with this is a wrap on this edition on Phone In. India's health sector can emerge as the biggest driver of growth, and we need to just take our precautions and be very, very careful. So mask up, India, and keep social distancing, and remember to take the jab. On that note, many thanks for watching. Namaskar.